Okay, so one procedure that's really popular at the moment, which
Yeah.
is really good, but a lot of surgeons don't do it. You're qualified enough to do this, is the endoscopic brow lift with the 2 endotines.
Yes.
A lot of people are asking,
Yeah.
what is that? How is
What
that
is that?
different to the old-fashioned forehead lift?
Okay. Okay. So we have to go to basic first. That around the forehead we have blood vessels, nerve that supply your forehead area to the scalp. Okay. And the problem of the patients who needs the lift is that when they get aged, they have tonic brow. The brow gets sagged. Some might have a hooding of the upper hooding on the side. Okay, so one might think that they need the upper blepharoplasty, which is the cutting of the upper eyelid skin, but that does not help at all, because something like this you need to have the brow lifted. Okay, so when you lift the brow, there are many techniques from the past until now. So it can be direct brow lift, but you will have the scar here. It can be indirect brow lift, but you might experience with just pulling up the skin, or you might have the injury of the nerve or blood vessels without seeing where the nerve and where the blood vessels are.
Yeah,
You might
that's right.
get that injured.
So things could be
Yes,
damaged.
or
Yeah.
if you want to see that, you might need a big scar. So
Like the old-fashioned forehead lift, which
yes,
is
yes,
all the way
yes,
around. Yeah,
yes,
that's-
and you get absolutely, you have absolute numb
Yeah.
of your scalp with the old-fashioned, the long scar here. Okay,
Yeah, that was the
that
old
that
technique.
will definitely cut the nerve. Yes, so that's why we have to use the endoscope. Okay, to see where the nerves are, to see where the attachment. We have to release the attachment of the brow underneath.
So an endoscope. What is an endoscope? A lot of
Endoscope
people
is
don't understand the endoscope.
that's the camera. Yes, we can use a tiny scar, and we can
So
insert camera.
where's the incision for the endoscope?
The world standard technique, they need 5 scar. Okay, one in the midline, 2
So this is in the hair.
in the hair, yes, they need five places of the scar, but I think 99% we don't need 5 scars, so we use only 4. Okay, we use only 4 scar. The scar will be for this side,
About a
this side,
centimeter max, yeah.
1.5 2 centimeters. Yes, we go in, we can see everything clearly from the 4K camera.
Right.
You can see everything.
So there's
we
a very low risk of any nerve damage.
low risk. Yes. We can dissect it clearly. So this is where the brow attached to the bone. This is very sticky underneath. So we need a very accurate release from here, and we have to be aware of this area, which there's a bundle of nerve vessels. This is how the endoscope helps. And also the muscle here, the glabellar area, this is very important. So we need to release, and we have to weaken the muscles here, because it will affect the long-term results. Okay, when we frown, this muscle will pull your brows drop again in the future. But if we can relax and weaken these muscles, so this one, the result will last much longer. Okay, in the past, they grab and pull this muscle away.
Oh wow.
But it ends up with hollowing in this area because there is no thickness of the muscles here. But the technique that I do, I just weaken the muscles. You can have some facial expression, very minor here. Yes, but without any hollowing here. Okay, with last longer results.
That's good.
Yes, when we use the camera, we dissect everything clear. We can lift the brows up, but the quickest way to hold everything up here to make the brow stay is the endotines.
Endotines. So
It's
what
the
are
tines.
what
It's
are
the
endotines?
absorbable, tiny absorbable instrument placed somewhere here. It can be placed. We can adjust the
Placement.
where the placement. So it depends on your brow shape preference. Okay, so you might like the tail of the brow up. We will place the instrument a bit far apart. Yeah, we will pull the brows up like this
Get a
way.
V shape
Yes,
eyebrow.
yeah. For some Asian, they need more flattened shape. We can adjust the placement of the tines. Yes.
So they get placed in and then basically fused, and over time they'll dissolve.
4 months. At 4 months, it will start to dissolve,
Yeah.
but it will take about a year
Yeah.
to have fully absorbed it.
So that gives a very natural look with no
Natural.
scarring, basically. Yeah. And
Right.
just lift the brow, lift the
Lift the
area,
brow,
just lift the eye.
lift the, yes,
Yeah.
lift up the eyelids. So some patients might not need the blepharoplasty.
After that.
Just lift up the brow, and if you consider the facial profile to be, if you divide it into 1/3, 3 parts,
Three
yes,
parts.
yes. When we lift the brows up, you can see that. When we lift the brows up, you can see that you will look more fresh. You have more freshness. When you compare it, one who have the brow close to the eyes, just look more angry.
Angry.
This is the angry look.
And that
When we lift
aged
it-
look,
Yes.
yeah.
Yes.
Oh, that's good. Thank you.